I'm re-airing a few classic episodes from Health Literacy Out Loud while I recover from back surgery. Hope to make new ones sometime soon. Enjoy them all. Happy listening. Welcome to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z, Practical Ways to Communicate Your Health Message. I also produce and host this podcast series, Health Literacy Out Loud. Today, I'm talking with Bridget Gaglio, who is a Senior Program Officer for Clinical Effectiveness and Decision Science Program at PCORI, or Patient-Centered Outcomes Research Institute, that's based in Washington, D.C. Bridget works there to improve communication and dissemination of evidence-based information among patients and their healthcare providers. She has published papers on patient-centered communication, health literacy, and dissemination and implementation of health interventions. Well, Bridget and I know each other through PCORI. This podcast is not about that. Rather, we'll be talking about experiences each of us faced as patients. For Bridget, this was because of an accident. For me, a scary diagnosis. Happily, we're both feeling fine and doing well. But our lessons have lasted a lifetime. That's what we want to focus on now. Welcome to Health Literacy Out Loud, Bridget.
Hi, Helen. Thank you so much for having me.
All right. We're talking about being patients. It can happen in a moment. My diagnosis came out of the blue. I wasn't expecting it. And you were in an accident. Would you share a little bit about that just to put it in context for all of us?
Sure, yeah. And it definitely happened out of the clear blue. I was doing my normal commute to work, which is either catching the metro or the bus, since I live in Washington, D.C., and I was crossing the street in the crosswalk, and a car was turning, and they didn't see me, and they hit me.
Oh, yeah. I know. And I saw you months afterwards, and you were just still reeling from it.
Yes.
It wasn't just like a little, oh my goodness, that was a bad thing that happened today. You were really injured, right?
Yes, I was very injured, and it took several months and lots of doctor's appointments to recover.
Okay. And you are feeling well now, right?
Yes, I am. Thank you.
Good. Okay. So this happens in a moment. We're not planning for it. You and I mean, we're on PCORI. We know what we're doing. We're both somehow involved with health communication. But when we were talking one day about these experiences as patients, I think we shared that it was hard for us too. And we have many advantages. We can read, we can do numbers, we know the healthcare system. Are you willing to share a little bit about what was so hard about being a patient? And that's in addition to the pain and misery you were going through.
Yes. In addition, it is overwhelming when you're feeling very vulnerable and not well. And then all of a sudden, especially for someone like me who has never been high utilizer of the healthcare system, having multiple doctor's appointments every week and having to keep track of not only the appointments, but the information I was being told when I wasn't feeling well, and keeping track of what I had done and what the results were. And it was just a lot in addition, especially when you're not used to having to deal with all of that.
Yeah. So you figured it out, I guess.
I
figured it out too. I'll just share with listeners. I don't want to leave you out there. I'm fine. Years ago, I just went for a routine mammogram that didn't turn out to be quite so routine. And that led me down a whole path of treatment and intervention. My story is that I also, like you, got overwhelmed with a flood of information coming at me that I was no way expecting. I couldn't keep it all straight. It was all I could do to have the courage to show up for appointments. And before this, I had often given talks to consumers about communicating clearly with your providers, and I'd tell people to keep your own records. Now my friends were telling me when I was saying, this is overwhelming, I can't even find my patient card to get a discount at parking, they'd say, aren't you the one that tells other people to keep their records? Why don't you do it? So I did. So Bridget, your story, you're overwhelmed. You're in pain. They're throwing information at you, and you were super healthy, young, dynamic before that car hit you. What did you do to figure this out?
Yeah, so in the beginning, I just would take everything I got, receipts, results, whatever, and just started piling them on my dining room table because I just was in denial that I think in the early stages, I was still in denial that this had happened to me and I was having to deal with all of this. And then like you, one day it was like, I have to make sense of this. This is my responsibility. Like, I have to take control of this situation, even though what happened to me was out of my control. I need to take control now. And like you, I've written on health literacy and patient and provider interactions. And I was like, what would I tell other people to do? It's like, get organized.
We're so good at telling other people what to do. Okay.
Exactly. So I went out to the office supply store and bought a binder and lots of tabs and a hole puncher. And I went home and started organizing everything into piles. And before I started putting it into the binder, I thought, you know what? I lose things. So to make sure if I do lose this, I'm going to scan everything in as well. And then also if a doctor needed something, I could quickly just attach it in an email and respond instead of like trying to figure out how to get it to them. And so I scanned everything into my computer and then I organized it all in this binder. And then every time I went to the doctor, I took the binder with me and just added to it as treatment continued.
That's really interesting. I did the binders too. As we're recording this, I took out my binders. Now I have 3. One was when I was diagnosed, so that one was just filled up with all that stuff I was going through then. I also did tabs, and I'll talk more as we go through this. Maybe we can share what kinds of information we put in our notebooks. And since then, since that one got pretty full, I bought another. Mine aren't huge. And that took me for the next few years as I'm dealing with some other stuff, but not at that intense level. And now I have a more recent one that happily I'm just having like routine checkups periodically. And I still find a binder helpful. And partly it's because now I may not see a doctor for a year or two. There's really no continuity in my mind, but I can look up the notes from last year and see what we did then so I can keep up to date. And then also, when I went through my episode, I didn't even consider scanning anything in or doing it electronically. I don't know if it's because yours was 10 or 15 years more recent or who you are or what it is, but I think that's an astoundingly wonderful idea to scan in your stuff too.
Yeah, thank you. I think it probably has a lot to do with having, the ability to email back and forth with providers now. I think if this had been very early on where like the patient portals didn't exist, I don't know that I would have thought to scan it in. Also, just personally, I've gone to a paperless household, so I'm used to scanning everything in now when it comes in just to minimize the amount of paper in the house.
Interesting. It's really neat for me to hear how we've kind of a decade later have updated this. Emailing my doctors was not even an option in my day. But that's history. What are you doing? What can our listeners learn? Because for our listeners, I'll tell you about them, Bridget. We all care about health communication, whatever our jobs and responsibilities. But we also are people. And chances are we're going to be patients at some point, or our loved ones or people we care about are going to be patients. What are your lessons learned you'd love to pass on that people can maybe put into place in their life, either as professionals or as people?
Yeah, I think a couple things. One is while going to a lot of visits and keeping track of all the information might feel overwhelming in the beginning, I think it also gives you a sense of being empowered because you are the person with all the information. And so to go into those visits with all of the information and to be able to share it with whomever asks you for whatever results or what you've had done, what you haven't had done, I just think it's very empowering to be able to go in and say, well, I still am not 100%. I still have all the information. And sometimes you just hand the binder over. You just are not feeling well enough, and you can just hand the binder over and be like, look under that tab. It's in there somewhere.
Wow.
Or other times when you're feeling better, you can just say, oh, here's the results. And you pull it out and you hand it over to the doctor. So I really feel like, unfortunately, with the way our healthcare system is structured, the patient is the responsible party for keeping all of the information straight. And so while it's empowering, I think it's also one of the most important things you can do for yourself and for your health.
How did your providers respond if you just said, here's my binder? Did anyone push back like, why are you keeping records? I'm keeping records?
No, I actually didn't. I didn't have any pushback at all. I think because the doctors I was seeing knew that I was seeing a number of doctors, and that I was being asked a lot of questions. And there were days where I really didn't feel well, and so I would just flip the tab to that section they needed, and was just like, "Here's my binder. The results are in this section," and they would look through it. And they were. I think they were really receptive to it and appreciative that I at least was taking the time to bring all of this information with me to try to have them help me make, heads and tails of what needed to be done and when.
That's great. I had an experience where I went for some very, very early morning procedure, and I had my binder with me too. My husband was sitting in the waiting room. And my doctor, for some reason, I don't know, there's miscommunication. My paperwork or the referral did not get faxed over to that person doing that procedure that morning. And if they didn't do that procedure, then I couldn't have that bigger thing that was going to happen afterwards. And so the whole thing, the whole day, the whole experience was going to be screwed up. And I said, no worries. Go ask my husband. He's sitting in the waiting room. He has the binder. And they found it. It was easy. I had tabs too. Looked for it. There was my copy of the referral form, and everything went on as planned.
That's fantastic.
And that doctor, I remember, said to me, I wish everybody would do this. She said, I'm a quilter. I have a binder of organizing all my craft information. Why don't people do this for their health information? So it's a story that stuck with me for years.
That's fantastic. Because, otherwise you would have had to have everything rescheduled, and who knows how long that would have taken.
Well, for me, it would have screwed me up because I was ready and I didn't want this thing to happen, but it better happen and get it over with. And it would have hurt the healthcare system because they saved whatever slot they did for me to have this thing happen.
Right.
Now, you and I, Bridget, we acknowledge we go into this with a lot of advantages. Our knowledge about healthcare, our savvy about it, already a sense that this is kind of our right to be empowered and control this information. What tips would you give for others who maybe don't feel as confident in doing this?
That's a great question. I think about it, and one of the things I would definitely recommend is to bring somebody with you.
Okay.
I didn't do that with all of my appointments, but in the early stages when my father was here, I brought my dad because I knew, beforehand I told my dad, if I forget to ask this question, make sure to ask it for me, and feel free to jump in if you have something to add. I felt like that kind of took the responsibility off of me to where I could just go and get the care, and that someone else would be responsible for getting the information and making sure I had it. So I think if folks are not feeling as confident, is to bring a friend, bring a family member who will have no problem asking the doctor any questions on your behalf, so that you can share that responsibility with someone so you don't have to feel like it's all on you.
Oh, okay. Actually, I just had the experience this week. We have a relative who's quite ill. I was with her as she was having a second appointment. We talked ahead of time about how my job would be to take notes, and if I think of anything to ask that she hadn't asked, to speak up. But this freed up our relative to be so fully engaged in that important medical conversation that she didn't have to worry about it. And then I came home, I typed up my notes and sent it to her, which I knew then she was going to send out to others. So that role of that extra person is just key.
I've even instilled that with my parents because they're older and they go to a lot of visits and they have a notebook. And every time they go to the doctor, they both go, and who's ever not being seen takes notes in the notebook.
Great.
And they have a running record for both of them. And then if I know that they've had a doctor's appointment that week, when I FaceTime with them on the weekend, I'm like, hey, get the notebook. Tell me what was covered in the visit. And they go get it, and they share with me what the visit was about.
What a powerful tool there. What can providers do? Because we've got clinicians and public health folks and all kinds of listeners here. What can they do to encourage their patients and loved ones to do something like you and I did, each in our own way? You and I had no idea we had this in common until we chatted about it coincidentally. What do you encourage professionals to help this out?
That's a great question. I think the after-visit summary that a lot of providers are starting to give patients is helpful, but I think instead of the nurse or the staff just handing it to the patient as they are walking out, that would be, I think, more meaningful for the provider to sit down with the patient, to go through it, to say, okay, remember, this is what we did today, this is why we did it, so that it sticks with them. But also the provider can say, next time you come, I'm going to see you next week, make sure you bring X, Y, and Z because I'd like to look at that so that we can decide what we're going to do going forward. Something along those lines, just to, keep that conversation open and going with the patient.
I really like that. I did a podcast once on after visit summaries, and I know in my experience, you're walking out and the PCORI registration or something just gives you a piece of paper. There's no reviewing at them. There's the end of the conversation ended when the physician left the office.
Yeah, there's so many times I just take it, I stuff it in my bag, and then, I might look at it that night or the next day just to, okay, yeah, that looks like what happened, but I have no connection with it.
Something I would like people who could help spread the word, and I hope that all our listeners do that, is whatever situation you're in, create your own binder. Look at the power of this yourselves. Bridget and I came to it in our own way, it just happened. But if you're in a professional situation, you might encourage others to keep their own binder out there. A couple things about the binder. I also just go to my local little office supply store and I pick out my favorite color because why not? It's my binder. The other thing that I put in it, aside from the tabs and all that good information, I got a zippered pouch. I think it might have cost me $1. In that zippered pouch, I put in my appointment slips, my patient ID cards, and I keep a pen in there. And the reason that pen is so important to me is if I'm alone in an appointment, I don't want to have to remember it all. I probably brought in a list of my questions, but if you look around a doctor's office, there's probably not a good pen around. And I didn't want to go fumbling looking for one. So all I have to do is open the zippered pouch and it's there. So that really helps a lot. Bridget, you are terrific. I mean, neither one of us asked for these situations in which we learned these lessons, but the fact that we are sharing them, I really find this very, very moving. I'm just curious, what color is your notebook?
That's a great question. My notebook is white, which is not my favorite color, but I just wanted something that I could easily see. Every bag I have is black, and so I just thought a color I could easily see in my huge bag that I carry around with me. But all the tabs are very bright and colorful.
Oh, that's neat. Like we need a dose of whimsy. So my binders are like these funky, bright colors, and probably the tabs are more ordinary. But they have meaning for me. And I went back to buy a new notebook. I forgot, I bought the same color I had a few years ago. I keep liking that color. Whenever we do I loved the way you phrased it, that this is a way to stay in control, to stay empowered, and indeed, patients need to be the experts on being patients. Bridget, I'm so glad you're well, but I also want to thank you so much for sharing some of your experiences and lessons learned with listeners of Health Literacy Out Loud.
Well, thank you, Helen. I really appreciated this, and I appreciate all your support while I was healing, and I'm glad you're well, too.
Let's keep going.
Yes.
Thanks, Bridget. As we just heard from Bridget Gaglio, it's important for patients to take care of their own information, too. But whether as providers or patients, health communication is not always easy. For help clearly communicating your health message, take a look at my book, Health Literacy from A to Z. And for this content, you might want to especially look at Chapter 5, that has much more information about communicating when patients feel scared, sick, and overwhelmed. You can also contact me directly at helen@healthliteracy.com. Health Literacy Out Loud podcasts come out every few weeks. You can get all the episodes automatically by subscribing for free at www.healthliteracyoutloud.com, or find us in iTunes, Google Play, Stitcher Radio, or wherever else you get podcasts. Please help spread the word about health literacy and health literacy out loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.